One of the mysteries of the coronavirus is why it doesn't hit kids as hard. Children are being infected, but they're not getting as sick. And now the National Institutes of Health is trying to find out why.
I would never picture me having to be intubated and being in the hospital.
16-year-old Carla Duarte is a coronavirus survivor. The high school junior from New York is one of the relatively few children in the U.S. to have severe complications from COVID-19.
Her numbers were not improving. Her oxygen level was not improving.
Doctors told Carla's mom, Anna, they had one treatment option left, an ECMO machine, which pumps and oxygenates the patient's blood outside the body.
When they told me about the machine, they said, this is 50-50.
After 7 days on ECMO and 5 more on a ventilator, Carla's condition finally improved. She was sent home after 21 days in the hospital. Serious cases like Carla's are rare, complicating the efforts of investigators.
We have much less experience because the children are just getting less sick, so there are many fewer children interacting with the healthcare system and being tested.
Dr. Tina Hardert of Vanderbilt School of Medicine is leading a new NIH study remotely monitoring about 2,000 children and their families in 11 cities nationwide. She says more data should be collected before a decision is made to send kids back to summer camp or school.
I think it's really risky to base decisions about this based on the fact that children get less sick from this virus, because that does not equal children being less likely to transmit the virus.
Boston Children's Hospital is running a separate study.
We have seen the full range of illness amongst the kids that we've admitted.
Children's has treated dozens of kids for the coronavirus since the pandemic began.
Some are incredibly sick, and some are essentially asymptomatic and get picked up because we did a test before an operation or that sort of thing.
Dr. Michael Agus says there are some theories why kids don't get as sick. One of them involves the maturity of the lungs.
The best we understand is that the virus binds to a particular receptor in the lungs, and that receptor is much more common as we age.
Now, the Children's Hospital study will look at 800 children at more than 35 hospitals across the country. And Paula, it is one of the saving graces of this whole outbreak that children have not been as impacted.